All right.
Can we
Okay.
get
Well,
it on?
okay. So welcome. Thank you everybody for joining us for our 6th BT Reach session. So as I stated before, this session will be recorded to be put on YouTube. And so I'll leave it off to Jillian to introduce our speakers for tonight.
Yes, so tonight we have Ingrid Henninge, who is the interim nurse manager of the operating room and surgical procedures. We have Melissa Steward, who is a nurse educator, and Allison Morrow, who's an OR nurse first assist. And so we're going to get to hear 3 different avenues into nursing and how they get to work together.
So as always, please put any questions that you have throughout this session into the chat, and we will be sure to address them at one of the 2 Q&A sessions, or during that time you also may ask questions as well. And from here we'll get right into it, starting with Melissa, who's going to share how she got into nursing.
Excellent. Can you hear me?
Yes.
Oh, perfect. My name is Melissa Steward. I am a registered nurse. I am also a nurse educator for the operating room, just as the introduction said. And so what inspired me to go into nursing? And a lot of reflection on this, and I can honestly say I can never remember a time not wanting to be a nurse from little girl. I had family history. My grandmother was a registered nurse in the 1930s before she was married, and she was a very respected member of her community. She did not continue nursing in the formal sense once she married, but she was always on call for the family physician. I remember hearing my mom tell stories about that. But even when we would go see her, she was a respected member of the community, and people referred to her as a nurse. So I remember vividly images of that and her being helpful in the community, which was very appealing to me. There was also, the barrage of shows when I was growing up of nursing and how, they took care of patients and the important role that they offered for taking care of patients. So that was a really big part of why I wanted to go into nursing. And I can honestly say there was never another career that I wanted to go into nursing. It was either nursing or I'm not sure what the other avenue would have been. I think that is the answer to the inspiration. So as far as education, so I grew up in Canada, just outside of Toronto. I grew up in a very, very large area outside of 20 minutes outside of Toronto. So I believe right now there's 650,000 people in my town where I grew up. So it's very multicultural. It allowed for lots of access to amazing healthcare and opportunities for school. So you can enter nursing into 2 ways in Canada, similar to the United States. So you can enter through a college program, which is 3 years, and you get the similar sense of an associate's degree here, or you can go to a 4-year university and get your Bachelor of Science in nursing. And so believe it or not, I applied for both programs, not knowing what I would get in or be accepted into. So I was accepted into Ryerson University, which is smack dab right in the center of Toronto. And it is around all these amazing institutions. And so they share with the University of Toronto. And so I did clinical experience at the Hospital for Sick Children, Toronto General, Mount Sinai, the big trauma hospital downtown Toronto. There was amazing opportunities in full 4 years that I was there. But little does anybody know that in 1996, when I graduated, there was a surplus of nursing, which I can't even believe that actually exists. So when I graduated, there were no jobs for me to apply into. So I applied for a postgraduate certificate program, which is in the operating room. So it was at a local college, and I did my, I started in September. after I graduated nursing school, and continued on with some clinicals for another 5 months. And again, I wasn't able to really get hired anywhere. I did a couple of hours here and there all over. But I then knew that because of this, I still wanted to practice nursing. So a lot of my colleagues, they gave up on nursing because there was no jobs for anybody, and they were starting their lives. They were getting married, and so they didn't have the opportunity that perhaps I did. So was not getting married. I was single. I applied for my nursing boards in New York State. I wrote my NCLEX for New York, and I quickly moved down to the United States in 1997. So June of 1997, I moved down and I spent a year in Florida, and I worked in the operating room there. And I will tell you, it was the funniest ad. I answered an ad in our professional operating room journal, which is called AORN, and I flipped to the back of where they post for jobs, and it said, "Bring your skills to the beach." And so it was in New Smyrna Beach, Florida. So it was a small town 20 minutes south of Daytona Beach. And it was an amazing year that I spent there. I grew professionally. I worked every day in the operating room, long hours, interesting cases, interesting patients. But I quickly knew that the weather down in Florida was not going to be for me. So I, again, turned to the AORN journal, and in same fashion, flipped to the back, and it said, "Come to Hawaii." So I applied, and off I went to Hawaii. So I spent 6 months in Hawaii. I then went to California for 6 months, went back to Hawaii for another 2 years. It's where I met my husband, and he was in the military. He was in the Navy. So he got orders to Virginia. So we moved to Virginia. And so I traveled from 1997 to 2005. Sorry, it was more like, it was 2005. 2005, I spent that time traveling all around with him. In that time, I really honed some great skills in the operating room. I became a member of the trauma team, lots and lots of amazing experience working with great trauma surgeons and trauma nurses. Spent a lot of time in the neurosurgery department, and every hospital has lots of orthopedic surgeries and plastic surgery a lot. So those were my main ones when I was traveling, and had a great experience. Worked lots of long hours, and worked with great people. And my husband got out of the Navy in 2004. So we were looking to move somewhere, put down some roots. And he actually went to Norwich University. And he said, "Hey, Mel, how about we move to Vermont?" And then I said, "Well, that's close enough to Toronto for me as probably we're ever going to get." So off we came to Vermont, and have been here at the University of Vermont Medical Center since 2005. I immediately joined the cardiothoracic team and worked from 2005 until 2018 on the cardiothoracic team. And for reference, for anybody that's watching, they do bypass surgery, they do cardiac valves, they do aortic surgeries. And there was 4 surgeons I worked with and 8 nurses primary. And it was the best part of my nursing career so far. I loved every minute of working on that team and with those surgeons and the anesthesiologist. It was a great team. But I realized that I maybe needed a different challenge. So there were some opportunities for me along the way to really work with students. They're either nursing students or registered nurses who were in the program of the operating room. And so I was a preceptor for a lot of those students, and I really, really, really enjoyed working with them. So I applied for my master's in nursing education because there was a couple of reasons why. Because I saw that there were different ways in which people teach, and I thought that there are good ways to teach and others that are not as supportive. And so I really wanted to dive deep into figuring out how to support nurses, young nurses that are coming through, to have them feel confident. And I really, really wanted to figure out how to do this because, you know, I have a personal situation where my son has some significant learning challenges, and I was influenced by his special tutor, who really showed me that there are different ways in which people learn, and you can't discount somebody if they don't learn at the pace that you want them to. So this was the real catalyst for me wanting to inspire change in myself and the people that I was working with. And so I applied to a WGU program, which was a 2-year master's in nursing education. And so from 2017 to 2019, I did that and worked on the open heart team. And then I was able to get a job opportunity opened up within the operating room, which was my desire in my plan for the operating room to be the nurse educator. And I patiently waited for the position to open up. And so from June of last year, 2020 to current, that is what I am doing. And love every second of it. It's great work. It's fulfilling work. And I'm happy doing it. So the next slide that is, you know, what are my responsibility as a nurse educator? So I have my bachelor's in nursing science. I'm a registered nurse, but then I also have my skills that I learned in my master's program of, you know, how to train nurses. So we have a shortage in nurses in the operating room. And so giving them the opportunity to learn and learn effectively is challenging when we're at a high pace, a fast paced environment. And we want to get them the ability to critically think, and providing the opportunities for them to do that, and not just do this show one, do one, and that is their experience. I really wanted to apply the skills that I learned in my master's. And so this past year, we've been doing a lot of simulation training. So pretending that there's a patient in the room, going through start to finish of how to bring a patient in the room, how to position patients properly, how to account for all instruments that are in the room, be able to work as a circulating nurse and also as a scrub nurse, which are the two roles that you can enter into the operating room as a registered nurse, and really developing a plan that's specific for them. And the other part of that is supporting the educational needs of the other people that work in the operating room. So there's many different roles that are in the operating room, and so we just don't do nursing education. We support all roles that are in the operating room. So we have, just as an example, there's patient care associates that help the registered nurse. They're like a nursing assistant, if that's similar in thought process. But we help them, we train them, get them going so that they can be active members of the operating room, and continuing education for our registered nurses and our scrub techs that are in the operating room. Those are important because we want to continually bring new information to people and be able to have them be proficient. And so there's always education that can happen. And I work with one other nurse educator that's in the operating room. And so we're busy for 200 people, staff members, and so we support 200 nurses / lay people that are in the operating room. So work-life balance. So this was a very difficult one for me. So a typical work week for me is, I arrive early for 6 and I go home probably about 4-ish, and I get there early to support the students that are starting. Our start time is 6:45 in the morning, so I want to make sure that they have the support and the preceptors that they need, that the cases that they are going to be experiencing or doing that day is actually what they need to be doing. So that's why I like to get there early. And then there's a couple of times I round in the operating room to make sure that the staff feels supported. If there's any education that they need. I get a lot of text messages from nurses that they need help. So I go and I assist them if whatever it is that they are needing help with. I do teaching in the classroom with the orientees. So we have quite a number of nurses that are learning right now. So there's once a week, we pull them out and we do snippets of training. So on a personal note, how do I balance that? And I was joking with Ingrid that I am a COVID gardener, that I never knew anything about gardening until this past year when everything slowed down. And I have developed quite a passion for gardening, in so much as that I entered my first bouquet of flowers of dahlias into the Champlain Valley Fair for judging today. And I have 2 boys. I'm a busy mom of 2 teenage boys that are running in every different direction, and I love every second of it. They're active, they're engaging, and that is my work-life balance. And it's funny, Dr. Mariquin, who was one of the previous presenters, she had said to me not too long ago that work-life balance doesn't really exist. It's work-life integration. And that's percolated around in my mind what that actually, what that means. And I really feel that the work-life balance is sometimes challenging because the hospital or the OR runs 24/7, and we staff the OR 24/7. And sometimes people's needs are in the middle of the night and they need help. And I answer the phone because, I think it's important that staff feels supported. And it doesn't happen that often, but I feel that the staff knows that I can help in any way that I can. So I really think that the work-life integration now is the term that I'm also embracing.
Well, thank you.
Yeah. Did I do my time accordingly? That was a little fast, sorry.
No, you did great. That was perfect.
Okay.
Thank you so much. It was really great to hear about your journey to where you are now. And next we are going to hear from Ingrid and how she got her inspiration into nursing as well. So Ingrid, you take it away.
All right. Good evening, everyone. Can you hear me? Can you hear me? Yes?
No.
Okay. Okay, good.
Yes.
Good. I just wanted to make sure because I'm a little challenged here. I'm working off 2 devices. My computer doesn't want to connect the the camera. So I may not look directly into the camera all the time because camera is actually being fed from my cell phone, which is a little bit below my computer. So you have to kind of work with me here. I might not be looking right at you all the time. So welcome to this session. My name is Ingrid, and I am currently the manager for the operating room here that Melissa has so graciously already really given you a pretty good description of. But first, my inspiration into nursing. And find it interesting that you are going to see that there's many ways to get into a nursing profession, because my journey and Melissa's journey couldn't be more different. While Melissa apparently knew from day one she wanted to become a nurse, I really did not. I'm originally from Germany. I grew up in Germany. During my latter school years, I really, I took to sciences. I especially liked biology. and anything about the human body. And I've really had a strong interest into going into med school or a career in the healthcare industry, but specifically med school. Now, many of you may not know the university system in Germany is quite different from here. It's all free. So, but it's also, because it's free, it's a little more regulated, I would say, and there's not that much availability. For example, in medicine, med school, it's very competitive. So when you graduate from high school and you want to get into med school, you have to have a GPA literally of like 4.0 or better in order to right away get into med school. Otherwise you get put on a waiting list and you have to do some things and, you know, just wait around, which wasn't for me at the time. Apparently I had no patience to wait around. So I just ditched that and went into a whole different direction. I got a degree in hospitality management, very different, I know. And that's what I did for my first career. I was a manager in the hospitality industry, met my husband, who was also working in that industry, and ended up traveling, you know, around the world in that function and living in different places. I ended up in the United States in 2003. We moved to New Paltz, which is about an hour and a half, I would say, north of New York City in the beautiful Hudson River Valley, and settled. And you know, I had kind of like a chill out moment where I thought, you know, back to my career. At that time, I was raising 2 sons and I was home as a stay-at-home mom. And I was looking forward to going back to work, but I had no inspiration whatsoever to resume what I had done before. I wanted to go into healthcare. So that's when I made my youth dream a reality, and I enrolled in nursing school. Thank you. And enrolled at SUNY Ulster, which is the school that was the local school where I lived in New Paltz. And I decided to get an associate's degree in nursing, which is still to this day your fastest way, I guess, into the workforce. An associate's degree enables you to sit for your NCLEX and to become a registered nurse. Just as a side note, back in those days, in 2006, it was probably easier to get a job at a hospital with an associate's degree. It's becoming increasingly more common for hospitals to actually want to see a bachelor's degree of nursing. But in 2006, I got an associate's degree and I got hired right away because that nursing shortage that Melissa was talking about was no longer. And we'll talk about my career in the next slide, but as I was working as a nurse in different functions and in different areas, I quickly noticed that I did want more, I wanted more education. I wanted to know a little bit more about anatomy and physiology. I wanted to delve deeper into pharmacology, into the treatments available. I just felt that I was always lacking. While I was given enough information to be a safe provider of care, I really lacked the depth and the background that I wanted to have. Like, why is this happening to the patient? Or why are we doing this with the patient? Why is the patient getting this treatment? So having moved to Vermont, my school of choice was now UVM. So I enrolled in a bachelor's degree program at UVM. They have a degree called RN to BSN. Actually, I have to admit, I don't know if that's still a thing, but they did have a degree where you had an associate's degree, you went to UVM, and in around 2 years, I want to say it took me 2 years, you got a bachelor's degree. That's what I did. I loved it. And it really gave me the background that I needed to be, in my opinion, to be a good nurse or a better nurse than I was before. But I didn't stop there. At the time, UVM had this little thing going, and I think that's how they kind of like reined in their students. If you were to seamlessly transfer into a master's degree program from your bachelor's, they allowed you to take 2 classes. Last 2 classes of your bachelor's degree, you were allowed to take master level classes, and they would apply to both degrees. So if you decided to continue your education, you actually already started with a bank of 6 credits into your master's. So I was like, sure, I'll do that. And I just kept going to school. Enrolled in the master's degree program of nursing at UVM, and I chose the adult geriatric nurse practitioner path. They had two at the time, family and adult geriatric. And that took me a little bit longer because throughout this entire time, I worked full-time, and I don't want to say part-time, but I took a little longer than students who decided to just go to school full-time. It's a pretty ambitious program, I feel like, the NP program, and it takes quite a bit of effort. You have to put in your time. It's a lot of studying, a lot of clinicals, but I liked it. So in 2016, I graduated with that master's degree in nursing. Yeah, that's fine. You can go on. A little bit about my career. So you heard that in 2006, I got my associate's degree, and I started my career as an RN down in the Hudson River Valley at Vassar Brothers Medical Center. Interesting tidbit, I was hired into the float pool because that's the only position Vassar Brothers would hire new nurses into, because I guess it was the least desirable position to have in the hospital. What's interesting is here at UVM, at least when I was working on a floor, they would never do that. You actually had to in order to qualify to be a float pool nurse, you had to have quite a bit of experience from different floors and have proven yourself as a nurse, because it's not easy to go to work every night. I was working overnight. It's not easy to go to work every night and be going to a different floor and work in a different environment and see a different type of patient. Sometimes it was vascular, sometimes it was med-surg, sometimes it was just medicine. They had a pulmonary floor. It was really overwhelming. And I was kind of happy to move on. My husband and I and my two sons, we moved to Vermont in January of 2007, and I started here at UVM Medical Center. And again, when I interviewed with HR and I told them that I was in the float pool, they were like, really? Well, you're not going to get that job here. I did start on an inpatient surgical floor, and I liked it. I worked overnights, 12-hour shifts, and all the time, if you remember the previous slide, all the time, or most of the time, latter time of that, I was also going to school because I was continuing my education. Taking care of surgical patients really started me thinking about the operating room. Like overnight, I would read the operating notes, the OR notes from the surgeons.
Sure.
I would read, I just look at charts and I would think, how could I become a part of that? This sounds so fascinating. So in 2011, I applied for an OR nurse internship. I got hired, and I never looked back. I love working in the operating room, and I loved being an operating room nurse from day one. It's a really exciting place. I think Melissa already gave you a little insight into the different roles. We have nurses, we have scrub techs, we have anesthesia techs, and everybody works together as a team to take care of a patient. So when I graduated from UVM in 2016 as a nurse practitioner, ready to fly on my own and find a job, people were asking me, so you're going to go and be a nurse practitioner now? And I started thinking, I'm like, I don't want to leave the operating room. This is what I love. So here I am. 4 years later, I'm still here. I just couldn't leave. I really love this kind of environment. So when a leadership position became available in 2017, that was actually looking for an advanced degree, I thought, okay, this is where my advanced degree can come in handy, and I can still stay in the operating room and be a part of this. I applied for that job and I got it. And then earlier this year, my manager left us to move to another state, and I was offered the interim nurse assistant or operating, the interim, it's a long term, the interim operating room nurse manager. That's what I was offered, and I will actually apply for the permanent position soon. My responsibilities as the interim nurse manager for this big unit is overseeing the staffing and the daily operations of 21 operating rooms. So running full steam, we have 21 ORs. Basically, they're booked from around 7:25 to usually our core operating time is around 5 or 6 o'clock, but we have several rooms running late every day. So to put staff into those rooms and to make sure these rooms are staffed literally around the clock. We're a level 1 trauma center, so we have staff in the OR around the clock 7 days a week is a big job. And I can't do it myself. So I actually have an assistant nurse manager that's working by my side also. Resource management. It's kind of like the drab side, I would say, of leadership is, you know, you're the shepherd of the budget, and you have to look at equipment and purchases. You have to replace broken equipment. Some surgeons ask for new equipment and decisions have to be made. Obviously, I don't make those decisions alone. I have to ask other people for their advice, and people sit around the table with me and we make those decisions together. That's where the interdisciplinary collaboration and communication comes in. I would say that I have to work a lot with anesthesia and with surgeons, especially if there are issues, if we identify some opportunities where we can improve how we do things. It's my job to bring people together from all sides and to facilitate discussions around how we can do things better. Melissa was speaking about the employees. I thought it was around 175. I may have lost count. Melissa was talking about 200. Recruiting and maintaining the workforce, very challenging in healthcare. Everyone knows about the nursing shortage, especially in a field like the operating room where you have to be specially trained. Training an operating room nurse takes 10 months. When I came from the floor to work in the OR, I took 10 months of not being productive, of just being trained in order to learn this job. So you can imagine it's not as easy as just putting up an ad in the newspaper unless you get a lot of experienced OR nurses that want to move here or want to live here. You have to actually train. And that's where Melissa comes in. You have to actually train your workforce. Lastly, my most favorite part, I think, most favorite part of my job, but at the same time, perhaps the most challenging, is creating an atmosphere that fosters positivity. And because positive people provide better care, I think that also promotes excellent patient care. So I'm really looking forward in this position to facilitating in that respect and just trying to create an atmosphere where people are happy and people like to be and people like to work together with each other and have minimum amount of conflict with each other. And that in itself will then enable us to provide excellent patient care, which is the end result that we're all working on. Okay. I'm in my office in scrubs, as you can see, as the sun is setting. So work-life, what did Melissa call it? Work-life integration is also sometimes challenging for me, but I have to say it's possible, and I'm really trying to work very hard on getting a better balance. As I only took over this job in March, and my position as an assistant nurse manager, there used to be 2 assistant nurse managers and a manager on top. Right now, there's just me and 1 assistant. So I've probably had a bigger workload than I should have. So it's kind of hard for me to look back and say I have a good work-life balance. I'm hoping this will get better as we are then at some point fully staffed again in leadership. But the ability to work remotely, I can't stress that enough. I think it's really, really great to have that opportunity. And that is a definite benefit in my position that I quite a few of my meetings are remote. And obviously a lot of my work is online. So where I do that, as long as I don't have any in-person meetings, isn't really that important. So to give you a concrete example, I came in this morning at 6:30 because on Thursday mornings, we have our big all staff meeting where we all are in person. So I've been here in the operating room area or at the hospital since 6:30 this morning. And I'll probably stay for a while because I'm kind of in charge tonight of the operating room, but that's okay because tomorrow, all of my meetings, I have like 2 or 3 meetings that are remote. And I've already talked to my assistant nurse manager and we made arrangements that I will work remotely. So there's that balance that I'm going to put in a really long day today, but tomorrow I'm going to work on my porch and I'm going to see my backyard and I'm going to be with my flowers and I'm going to do my meetings, but maybe between one meeting or the other, I can run and hang up a load of laundry and then I'll run back and do a meeting. So there is a benefit and there is a way, I think, to balance that if you're in a position like mine. And I consider myself lucky. I do work Monday through Friday and the peri-op managers share an on-call duty. We rotate weekends just in case of emergencies that there is a leader on call for staff. All right.
Thank you so much, Ingrid.
You're welcome. Hope I didn't go over.
Nope, you are all good. Oh, if you do want to just talk about this, we have time. So.
Yeah, sorry. One really interesting thing that I just want to share, if people are thinking of opportunities and why having a special skill like being an operating room nurse can come in handy to have great experiences, is I was able to go and travel on a medical, I guess I want to call it medical mission trip. I don't really like the word mission that much, but UVM does a lot of charity work, and the surgeons do these trips where they go to third world countries and perform surgeries for free, and they bring staff. So I wanted to show you a picture very quickly of the operating room at UVM Medical Center. It's actually our hybrid OR, our vascular OR, and you see lots of staff, lots of high tech, only the best new equipment. Everything is shiny and bright, and that's how we get to work because we're lucky. And if you go to the next screen, you will see how when I travel to Haiti with one of our surgeons, how the operating room looks there. And this is their most high-tech room that they have in this hospital. And it was actually the first ever laparoscopic surgery that was performed there. Somewhere they found a camera. We brought the trocars and the equipment from here. We brought a couple of scopes because the surgeon knew he would be trying to take a gallbladder out laparoscopically. They had never seen a lap, we call it a lap chole, a laparoscopic cholecystectomy. They had never seen that before. So that's why you see all those people standing around staring at the screen in wonderment. And let me tell you, the camera was really bad. The scope was almost blind. It was a very, very difficult surgery, but the people were blown away. So this is an opportunity I had while I was an operating room nurse, and I will never forget that.
Thank you so much. And now we just have Allison to talk about her inspiration into nursing as well. And for anyone that has questions, they can put them in the chat now or during the Q&A for any of our speakers.
My name is Allie, and I'm a registered nurse first assist. For me, my career choice is a little bit different. About 20 years ago, I was in the construction industry. I had 2 young children, and the younger of the 2, he was 2.5 and totally sweet, developed a fever. Okay, it was this relentless fever, and it wouldn't go away. We went to pediatrician after pediatrician. He ended up in one hospital, then was transferred to another. All the while, it was not having a medical background, it was very confusing and scary, and I felt truly helpless. Medical professionals would come in with these lab results, and I wouldn't know what they meant. He went off and had these procedures, but I never really even had any good questions to ask. I just felt I was really uninformed. So he recovered, and I'm so glad he did because he's so awesome. He recovered, and I decided that if I'm gonna have a son who has a chronic condition, then I'm gonna have to be able to navigate healthcare. I'm gonna have to be able to get through the healthcare system, work with insurance companies. So I basically quit my job and went to nursing school. So it sounds like, oh, you just quit your job. There was a lot of details that went into it, but I did. So the requirements for me was, okay, I need a quick RN degree. You know, how can I get this done? It has to be close to my home, and tuition had to be reasonable. So I lived in Westchester County at the time. I found a school in Yonkers, New York, and I went to the Cochrane School of Nursing. And it was an 18-month program, and it was super fun. You know, most of the nursing students at the time were people like me, second careers. It was back in 2001. And it was great. It was a really quick 18 months, and I came out with an associate's degree, and I sat for my exam and passed. And I didn't really know what type of nursing I wanted to do, but I knew what type of nursing I didn't want to do. I didn't want to be on a floor and take care of multiple patients. I needed something smaller. So my first job out of nursing school, I worked on labor and delivery. So you have one patient and one baby. And I worked 12-hour nights. And it was great. It was totally terrifying and exciting. And it was a small community hospital with not a lot of support, no residents. So it was a great learning curve and an experience that I'll cherish. A couple of years in, I really wanted to move home. And home for me is Burlington, Vermont. So we moved home, and I took a job at UVM Medical Center, also in labor and delivery and working nights. And I just thought with the move that I don't want to change too much. I want to go with what I know. Saying on the lot. After working a couple of years at the night shift, I realized that night shift work just really wasn't for me. I was suffering mentally and physically. I was in the cloud all the time. I was never really awake and never really asleep. And that's one of the great things about nursing, is that you can transfer and you can do other things. So I moved to the operating room. They were offering a 9-month perioperative internship. And I was like, oh my gosh, this is going to be great. I'm going to work night, you know, the day shift. I'm going to sleep at night when it's dark out. So I moved to the operating room in 2005. My preceptor was on the orthopedic team. So operating room, like Ingrid said, and Melissa, it's very specialized. And even within the special, even with the special operating room nurses, we form these teams. So my mentor was on the orthopedic team. Me, I saw many total joints and and spine surgery. And I kind of had this thing for spine. And at the time, there was this woman who had this unique role. She was an RNFA for the orthopedic spine department. And she was amazing. She could do everything and anything. And I said, I want that job. So for me, my path was to get that job, basically, when she retired. So with my 2-year degree, there's a lot of positives. You get out quickly from nursing school, you can have a nice paying job or decent paying job, but only having a 2-year degree kind of limits you as well. So to become an RNFA, you need a 4-year degree. I went to UVM and I completed my BSN with the RN to BSN program. And then also another requirement of becoming a registered nurse first assistant is you have to become a certified nurse of the operating room. It's a certificate, and I obtained that. And then I just bided my time waiting for Cynthia to retire, and finally she did. I applied for the position, and I have to say I'm very fortunate that I got the job, because it is the best job ever. So if we just want to go on to what I do, my job is really fluid. It changes every day. So I'm a first assist. So what that means is I can stand opposite of the surgeon, the attending, and assist in surgery. What I'm allowed to do is dictated by Vermont. So RNFAs in different states have different responsibilities. So what I can do in Vermont may be different than in other states, but it's only part of my job, you know. So I do assist, but I also I help out. I establish relationships with the workers. I work with the residents. I'm a problem solver. I find equipment. I request implants. It's always changing. But my goal basically is to promote efficiency and flow, whatever that means, you know. So it's a great job. It's always changing. It's totally fun and physical. A typical work day for me, I follow 4 orthopedic spine surgeons, and that is typically a 4-day operating room schedule. We normally start first cases at 7:25. I'm in the OR at 6:30. I like to be able to assess the room, find equipment before a lot of the, people arrive. And on Tuesdays, something special that we do, we meet and have spine conference. And that's a really great educational meeting once a week. It's with the spine attendings, ortho, and also neuro spine attendings. We have the residents present, some PAs sometimes, the spine nurses from the clinic, and also the MAs from the office. And we discuss upcoming cases, and we also review the past cases. So it's a great collaboration and very educational. What else can I say? One of the reasons why I love my job is that I work with different disciplines. So today I was in the OR, and just for example, in our OR today was the attending spine surgeon. We had a medical student. We had an attending anesthesiologist and an anesthesiologist assistant. Then there was an anesthesia resident. We had a circulating nurse, a scrub tech, and a PCA, which is a patient care attendant. So just imagine you're working with all these people, and there are so many of us that, you know, Melissa was saying 200 people. Well, add in anesthesia department and there are so many people. It's such a great community, and you get to work with many different people, many different ages, many different levels of experience. And one thing I'd like to just mention is these patient care attendants. I mean, they're truly great, and it's a great entry-level job for someone who's thinking about a career in healthcare. Because they're exposed to all those disciplines that I just mentioned. And it's I don't know, it's this great exposure. And I have stopped counting the number of patient care assistants. Is that what they are? Or associates? I don't know. Okay, well, the patient care assistants, there are so many that are now doctors, anesthesiologists. They've gone to nursing school, they've gone to surgical tech school. There's one who's a perfusionist. So I think for young people who are thinking about a career in healthcare, that would be a great way in, just to see what's out there, because I never knew it existed when I was thinking about a career. That's all I have to say about that. I think I've said enough. Oh yeah, one more slide. My work-life balance. Yes, I guess I just mentioned it. It's a lot of hard work. I love it. It's a great job. I'm very thankful.
Thank you so much. Yeah. And now we'll bring everyone up to the screen and do some questions. Make sure everyone's up there. Okay.
So I had a question for, this was, Melissa had mentioned it while speaking, but I'm sure all 3 of you could speak on it. What is the difference between a circulating nurse and a scrub nurse, and just kind of those responsibilities? I've definitely heard those terms before, but I don't really know, what those responsibilities might be and the difference between them.
Answer. So you can be a registered nurse in the operating room. You can have two roles. You can either be a circulating nurse or a scrub nurse. So the circulating nurse is going to be the person that is not sterile, not standing at the surgical field. So they're going to be the one on the outside. So they are going to be the one that is being the patient advocate. They are assessing the patient. They are not, I don't want to say I use the term running the room, but it's not like the person in charge, but it's the person that's coordinating everything that's going on within the operating room for that particular case. So the scrub nurse is the person that's going to stand right next to the surgeon, who's going to be sterile. They're going to be handling the sterile instruments. They are going to be passing instruments. They are going to be critically thinking of what the surgeon needs and wants next. And they are working as a team in the for the surgery. And I will tell you, you can have that job in another role. You can be a scrub tech or a certified scrub technologist. And so you can enter in that way in a couple of different ways too. So you can go to a program, a college that actually, it's big in the South. We do not have one here in the state of Vermont, but you can go to, I believe it's 2 years, and you get all different kinds of clinical experience. And then you graduate, I believe, with an associate's as well. And then you get to apply for certification. And so you become an CST, so certified scrub technologist. And that person does not have a degree. They are assisting in that role. A nurse can do that. And the reason why we train the extent that we do is because we do both roles. So all the nurses, I would say 90% of the nurses that work in our hospital scrub and circulate. Yeah. And we have, when I came in 2005, I think there was only 5 scrub techs that were in. Now we have quite a few, but we're still nurse heavy in that we produce a lot of nurses in the programs that we are producing right now.
Thank you. I have another question for really all of you. I feel like we've all seen in the news a lot how nurses in general have really carried a lot of the weight of COVID-19, and how the 3 of you have really handled that and dealt with it through your specific careers.
Yeah, maybe I'll speak to that. That's an interesting question. And you'll be, you may not have thought of it that way when you first think about the operating room, but we really are an island a little bit onto ourselves, and we actually did not get a lot of COVID exposure in the operating room, because when you think about it, when somebody has COVID and they need a surgery, actually the outcome, when somebody has a surgery and they're sick with COVID, the outcome is actually much less favorable than if they were healthy. So the surgeon will always decide, is the surgery critically needed at that time or not? So let me think back. I hope I'm not missing anyone, but we have in the last year perhaps performed surgery on, Melissa, correct me if I'm wrong, maybe 5 or 6 COVID positive patients. And that's the only time our OR staff has actually been forced to deal with the disease. I mean, we deal with the disease and the burden on other levels. For example, we have to make sure that everybody who comes through the OR has their COVID test in the appropriate window. If they don't have their COVID test in the appropriate window, we have to wear extra PPE and do some extra things and how we treat them in the OR. But really dealing with COVID positive patients where we know they're positive and they have to go to the OR hardly happened. Consider us a little bit privileged in that way, maybe as nurses. Maybe it's a sign that Vermont just was never hit that hard with COVID as were other areas of the country. Because of course, if you have a car accident, if you get into a car accident, or if you have a bad injury, or if you have an acute cholecystitis or whatever, the gallbladder needs to come out, of course it's going to happen whether you have COVID or not. Maybe we were just lucky. Melissa, Allie, do you have any other?
I would say preparing for COVID positive patients, we had to get all staff up to date on proper PPE, and we had to get everybody fitted into their N95 respirators. We had to make sure we had the adequate amount of supplies for everybody, and making sure that everybody had the ability to get the proper PPE and the training of how to put it on and how to take it off to keep themselves safe. And so that was a real goal of myself and management, is show people how to keep themselves safe and really encourage people to use the PPE in the way that it was intended for, so that we had the critical amount of supplies, and also to keep everybody safe and healthy.
Wow, okay, I definitely, it's good to hear that the three of you weren't in the thick of it, but also just you still did feel that burden. Now, the next question that again can go out to all three of you, just in your own experiences coming from such different, origins and how you got into nursing. What is your best advice for a student who might be struggling with classes or academic wise, but is still very passionate about nursing and really does want to break through into going into healthcare?
Keep trying. I am a big advocate for if you have to take something over, take something over. Don't give up on yourself. You have to, if it's something that you really, really, really want to do and it's your dream, do not give up on it. Find some way to make it what you need it to be. So if you need to ask for extra help, if you need to do a class over again, don't get frustrated with that. It's part of the plan. You're going to learn better the second time around. There's a reason why, and just be patient with yourself. There's lots of different avenues to get to the end result, as you see all three of us talking. If it doesn't work the first time, don't give up. That is my best advice. There's something that you're meant to do in a different way. And I know that talks from an almost 50-year-old woman reflecting back in her life, but all learning means something. So you can apply every single thing that you're learning along the way to the journey. Absolutely.
Thank you so much. I have a question for Ingrid, actually. Do you feel like your experience in the hospitality industry has helped in your nursing career?
Yes, it actually did. It's funny that you should ask that, because still to this day, I don't know why I do this, but every now and then I'll say hotel instead of hospital. I'm in a meeting and I'll want to say the hospital and I'll say the hotel, and people giggle. People giggle, but I do think that my career in the hospitality industry has helped me develop a people skill, like a skill that, you have to deal, if you work in a hotel, let's say you work at the front desk, like some entry-level position, you work at the front desk and you check people in. Or once I worked early on while I was going to school, I worked as a VIP concierge, like on a higher level. You know how some hotels have the VIP floors where, the rooms are a little bit more expensive, but you have your own little concierge who will do the dinner reservations and stuff like that. I had to deal with a lot of complaining customers that felt, because they're paying so much for it. And there's actually a lot of parallels there that some patients often will have these expectations that we for some reason can't meet for one reason or another. The experience is not what they thought it was. So I think as a nurse, you also have to deal with personalities, and you have to be able to adjust the way you deal with people. You learn that in nursing school too, but I think my hospitality industry helped. You learn how to deal with people and how to approach people and how it's best suited to their personalities.
Wow, okay, thank you for sharing.
You're welcome.
This is, again, next question for all three of you. Any of you are welcome to answer. But you all spoke a lot about like the training that goes into specifically working in the OR. But if you decided tomorrow that you no longer wanted to work in the OR and you wanted to do a different specialty of nursing, what is the type of training that might be needed for that? If you all know.
I can speak to that maybe. There are, I think, I'm not sure about Allie. I think Allie went straight to the OR, right?
Labor and delivery.
Oh, labor and delivery.
Yeah.
Okay, no,
Yeah.
never mind. So I think we all have a solid background that would enable us to go back, I would say, to that level of nursing, but there's definitely other areas, thanks for asking that question, that require equally specialized training. I would think of endoscopy, like procedure nurses. We have some colleagues downstairs who work in the cath lab or in interventional radiology. There's a lot of specialty areas that I can think of that even though I trained so much for this OR job, I would start again, basically from scratch if I went to interventional radiology or if I went to the cath lab, because I don't know anything about that type of nursing.
I also think that other departments have different internships. Isn't there like an emergency room internship?
Mm-hmm.
And also if I was interested in the ICU, there is internships to bring us in slowly and make, so we can be successful.
Thank you. And then Ali, I had a question for you about if you could describe really what a spinal surgery looks like what type of surgeries you get to see and do.
Well, the patient mainly is prone, so we see the back, which is always a little interesting. The patient will come into the operating room and see the spine table that we're going to place them on after intubation. What do we see? There's a number of discectomies. So if someone has a herniated disc, it's a very small incision and very long instruments in order to pick out that little disc in the bone, whatever is pressing on the nerve root. But then we also have very, very long incisions. So for scoliosis surgery in young adult, teenagers, or even sometimes in adults. So it goes from a very tiny incision to a very big incision, and I think it's just miraculous when we see a young person come in, with a curvy spine, and then after surgery, the patient may be 1.5 to 2 inches taller, and the spine is in perfect shape, and that's pretty thrilling.
Wow, thank you. That's really interesting to hear about. And then, so this will be our last question before we move on to the next portion. But again, if there are any more, we will have a second one to answer any questions that we didn't get to. So this question is for all three of you as well. Do you all feel like you get enough patient connection, patient interaction, even though, working in the OR, the majority of the time the patients are under anesthesia, but do you still feel like you get that patient connection?
I'll answer if anybody else wants to go as well. I always wondered, did I have a good relationship with my patients? Because sometimes anesthesia gives them medication, and so it has this retroactive effect where they may or may not remember going back to the operating room, or they may or may not remember being introduced to the circulating nurse. So, I always wondered, and I had this personal interaction with somebody I knew in an emergency situation. And that person remembered me holding their hand, remembered me talking to them. And it was a really, really challenging case. It was an emergency situation. And I had a personal connection with her prior to the surgery. But when I went to see her in the ICU after, she remembered me holding her hand. She remembered me talking to her before she went to sleep. So that, to me, at that point, changed my whole demeanor of, was I making a difference? You know, I was having skills that I was participating in the surgery, but after that moment, and I mean, I was 20 years into nursing at that point, I realized that I actually had a good amount of interaction with my patients because they remembered me comforting them, and that was fulfilling enough for me. Allie, do you?
I was just thinking about while I was a labor and delivery nurse, you know, it's such an intense, very intimate part of people's lives. And I would see people on the street, oh my God, you delivered my baby, you know, and I would see them grow up being in Burlington, in a small town. But it's interesting. It's just so different because in the operating room, there isn't that intense connection. You know, we only get a snippet. And due to the medications, sometimes, you know, I don't know how much is remembered. So I try to do the best I can with making a connection.
I think it's very unique. I think it's very unique. And what you just said, Allie, is true. We get a snippet, but at the same time, we get people at a really, really vulnerable point.
Yeah,
so
sure.
you only get a snippet, but you can make a real difference. The only thing is, as Allie was saying, the patient might not remember you because of the drugs they received during surgery that kind of blurs it all, but still the impact that you have is felt. And I do think that it makes their experience a better experience. So yeah, you might have a brief time, but I think it's very intense, for sure.
Yeah.
Thank you so much for sharing. And now we can go in to have the three of you talk about really what you get to do together in our case study section. So take it away.
Yeah, I guess I'll start off unless anyone else wants to. But in the operating room, when you have a patient intubated, you're always thinking of what can go wrong and having a plan, multiple plans. You're always thinking, okay, what's going to happen? What can I do if the patient isn't doing well? So in a situation that we were all in just recently, or it was actually quite some time ago, there was a patient who wasn't doing really well, wasn't breathing appropriately due to some medication. So, you know, so in the operating room, there's alarms. So you hear beeps and different sound, different tones throughout the day. So, and that just becomes part of your way. So when the sounds start to change, everybody's ears perk up. It's like OR hearing. And you can hear the heartbeat. You can hear when it slows, you can hear when it fast, but it's this background noise unless it changes. And then it instantly becomes very obvious. So when in the operating room, if you start to hear these changes in the tones and the alarms, you just become more aware of your environment. You look over, see what anesthesia is doing. Are they okay? Do they need some support? And you begin to delegate and you start thinking, okay, if I have to move this patient quickly, where's the stretcher that the patient's gonna go on? And what if we need more monitors or more equipment? Who's gonna get that stuff? So you start planning and you start delegating. You know, you make sure your PCA is right outside the door and you ask for help. You know, in each OR, you know, there's call bells, which if you call a code, that alerts the front desk, our internal control, which is the hub. So when those situations happen, you're prepared. So it's something that I do daily, and throughout, you know, you just think, okay, if something's going to go wrong, what do I need to do to help facilitate? You know, is there extra stuff in the room that can be moved out? Because if there is a code or if we need to get in any special equipment, we need to have the room. Melissa, do you want to take it from here?
Yeah.
Thank you.
So where the next person that comes in, so just remember the people that are in the operating room, you have your circulating nurse, you have your scrub technician, you have your PCA, and you have your lovely RN first assistant, Allie, that's in there. Then you have anesthesia, and that anesthesia could be the attending anesthesia. It could be a resident that's under the guidance of the attending, or it could be CRNA, which is a registered nurse who has specific anesthesia training. So you're working in conjunction with all of them, just as Allie said. So you're really observing, they're waiting for them to delegate to you what needs to be done, but you're also using your critical thinking, and you are thinking, all right, this doesn't feel right, this doesn't look right. So if something does go wrong, you know, what happens? So the nurse in the operating room would start facilitating all of the emergency. So the code button would be would be pushed. People would start coming in the room. And so the circulator nurse then is delegating to all the people that are in the room as well, what needs to get done. And so sometimes what happens is these situations come up and they're unfamiliar, or they just need a little bit of reinforcement or somebody to come in and stand with them to help guide them. And so a lot of times that's when I make an appearance up in the operating room. I get a text or a call and I come up right away and I help support, reinforce things that aren't necessarily everyday occurrences. So if we happen to be doing CPR, it's always good to have somebody that's on the outside taking a look to really coach to make sure that the CPR is being done adequately, and that we're switching when we need to be, and maybe there's some lines that need to be put in this patient. I am also the person that can quickly help put any kind of Foley catheter in. I can help anesthesia with arterial lines, central lines, just the person that is overall helping in the room as well. But underneath the circulator, she's the one, he is the one that is really coordinating all of that under the direction of anesthesia or the surgeon. So this particular case that we are talking about is a real case, and I was called in. Both nurse educators were up in this room in particular, and it took both of us plus the circulating nurse plus Allie and enough to get this patient safely discharged to the ICU. So it was a real hands-on approach, and it was seamlessly done because the nurses in the room knew who their resources were. Allie was great at being able to direct people in conjunction with the circulator nurse. And, you know, there was a lot of stuff that needed to get done afterwards, but it was a real team effort. Would you not say, Allie?
I agree. And just having the coaching there, I think was really helpful, because CPR isn't something that we train, but we don't fortunately have to do it. But Melissa, as a nurse educator, is training constantly.
Every day, all day.
Every day. So it's like, she's like dreaming of, you know, chest compressions, right? But so we need someone like Melissa, who's like this expert, just, to coach, to say, hey, you know, speed it up, or, you know, a little bit deeper, whatever it may be. So,
and make sure you're changing after every 2 minutes. You're going to get exhausted. You're going to be on adrenaline. Yeah. And so we want to keep this patient. We're not criticizing you for anything. We just want to make things really good for this patient and have the best outcome.
Yeah.
And then Ingrid comes in, and so you'll see on this slide that each one of us has different responsibilities, but in the center of everything is we are all registered nurses that all have the same education, we have the same experience, but now with different roles within the operating room. We all function slightly different, but we all come together with the same idea of a registered nurse. And so Ingrid then follows up with.
Yeah. Thanks for the introduction. That was a good one. It was very smooth. So while this situation, and I don't want to smile too much, it was a very serious situation, but it ended up well for the patient. But while the situation was going on, as is usually the case when we have an emergency or a code, as we call it, or some kind of sentinel event in the operating room, of course, leadership is also notified. There is a charge nurse at internal control that will hear, the code alarm go off, and they usually notify us because, as you can see in the background, my office is not in the middle of the operating room, it's more on the periphery. So we are notified, and my role was, in this particular case, not to be in the room because you heard, or I think Ali and Melissa gave a really good recount of what's going on in the room. There's a lot of different people in there. They don't need more, but what needs to be done is some coordination at the front desk. They need help outside of the room, for example, to communicate with the intensive care unit. Is there a bed available? Bed placement needs to be called. And informed that this patient is now going to the ICU. And a lot of these behind the scene things are things that are more of an administrative nature, but that are also supporting the events that are currently going on in the room, because the people in the room can't leave, but they can be supported by someone like me and the charge nurse directly from the desk by the things that we do. And then I think another really important role for me in this event or any event like that is to follow up afterwards and debrief. That means what do you mean? What do I mean by follow up is to really check in with staff. This event that we chose for the case study had a good outcome. There was excellent teamwork. Melissa was there, Ali was there, the patient recovered, patient was brought to ICU. Not every time there is a real sentinel event in the operating room, because sometimes we do take care of very sick patients or people who come in who had horrific accidents. A lot of times, or sometimes, the outcome is not so favorable, and it's really important for me to follow up with staff to see how is staff doing, because it doesn't matter how long you're a nurse or a healthcare provider, even how long are you a doctor or an anesthesiologist. When you have a tough outcome with a patient, it's not easy to move on. So debrief, talk about what happened, why, what went really well. Like in this case, a lot went really well. Debrief and say, hey, we did great. Who stood out? Where are opportunities for improvement? Did we get the things fast enough? Should we have done something better? So that's my job, follow up, debrief, make sure everybody learns from that experience, and most importantly, make sure everybody recovers from the experience and doesn't carry something with them on. And that could really impair you in future, in future situations like that if you don't debrief properly. All right.
Thank you so much. And I actually have a question right about that. For all three of you, what do you really do to practice self-care in these hard situations in your careers?
That's a tough one.
For me, I'm lucky enough to walk to work and walk home. I think that's very important to have that time outdoors, kind of decompressing from the day, or getting excited for the day as well when I walk up the hill. So yeah, I appreciate the walks.
I think the physical output, like you said there, Ali, is important to have something as an outlet, whether it be exercise, whether it be gardening, whether it be anything that like stimulates you, but something physical really is important to take care of your body. And trying to incorporate that more and more after a long, hard day is difficult, but the importance of it, like you said, is important, Allie. Like I said, I mentioned about the COVID gardening. And so that's a lot of bending, lifting, moving, and it's high heart rate kind of stuff, believe it or not. And so that's the thing that I've been doing for the last year and a half, and it's been enjoyable for me.
I think for me, it's definitely, I agree with all of you. I think physical exercise is always a release. Definitely, but I think on the opposite end of the spectrum, I also sometimes like to go inside and maybe do a little meditation and yoga. That if I'm in a really tough spot, sometimes that helps me more than physical exertion, is to have that calm. You know, when you do an online yoga class and you have that really, really calm voice talking you into this space where you are starting to feel really comfortable with yourself, and you can let go of these negative feelings or thoughts that may be lingering. Like if you have self-doubts, thinking you could have done better in a situation like that, that's when I do yoga.
And I think it's important to be able to, as Ingrid mentioned, you know, to have that debrief, because you can't really come home and have a conversation with your spouse about what really went on in the day because of confidentiality. And so you want to protect somebody's privacy. And so being able to share with your fellow nurse and really dive into what happened and how it made you feel. And if you have that supportive person at work, it is an amazing relationship. And talking about what is happening or has happened, I think is crucial.
Wow, thank you so much for all those great responses, as it's so important to, you know, consider mental health during the line of work that you all do. And then I guess on a more lighter note, again, for all three of you, what is your favorite part about, you know, working in the OR, and like, what is the part that excites you the most, and is what kept you there for as long as you've all been there now?
I love anatomy. I know it sounds really weird, but it is what it is. I love anatomy and physiology. I loved it in school. I loved it in college. I loved it in my undergraduate. I loved it even more when I became a nurse practitioner. It went even deeper. And what you get in the OR, and that's what I love, what you get every day is anatomy and physiology pure. Like when you're a scrub and you're scrubbing in a big open belly case, it's just all there. And you start to understand how the body works, and you see all the things, and you start learning what's abnormal and what looks good. That is what kept me there. That made me stay. And I could do it. If I could be in the OR more than I am now, I would, believe me, because it's just fun to see the human body and to see doctors who can actually fix things, you know?
And Ingrid means that all you have to is give her a call and say, Ingrid, I need, and she's making her way to you. She'll be the first one there to help you in the operating room. You know, the phone's dangling, I need, and she's just on her way already.
Oh, thanks. What about you, Melissa? What makes you stay in the operating room? What's the most fun part?
I do like working in a team. I like teaching. I like working with, I think it's team. I think it's the teamwork. Small teams. I came from here, 2005 to 18, working in the cardiac team. And it was a small group of people, and I loved working with them. I love the intimacy of knowing the person that you're working with and being able to depend on them, and knowing that they are working with you and they have your back. I really, really like that idea. In the operating room, teamwork is vital, because if you're not working as a team, it's the outcome is frustrating for everybody, and I like working on a really good team. Allie?
I agree. Teamwork. Spine surgery is pretty intense. I appreciate the team I'm with, and not all cases or not all days are easy, but we try to make them as smooth as possible. So that it's like a hard day, but boy, was it smooth. I don't know how to describe it, but I like working in the team. Yeah.
Agree.
Well, thank you so much for joining us tonight and giving us your time. Next month, we'll have our session as normal on the third or fourth Thursday of the month, and we'll be featuring Dr. Cecile King, who's an interventional cardiology fellow, as well as others that will be announced soon. And so thank you everyone so much for coming tonight. And thank you again, Melissa, Ingrid, and Allie for being here and sharing your stories. They're so interesting, and we really just love to get to really know you and what made you into the nurses that you all are today. So thank you so much.
And you can find this video. It'll be posted to YouTube shortly, hopefully in the next couple of days. And you can always follow our Instagram, which is @BTReach, and then our YouTube channel is the same. So thank you again, and I hope everybody enjoys their night.
Thank you, Lily. Thank you, Jillian.
Thank you.
Bye, everyone.
Bye. I lost my video.
All good.
I know. It was at the right moment, right? My phone just gave up. It's about to explode. It got so hot. All
Well,
right.
thank you so much. We have to end this on video, but have a great night.
Hi, Bridget.
Oh, no, I guess everyone did leave.
Yeah.
So beautiful. Thank you so much. That was awesome. It was perfect. See you next week.
Exhausted.
Hi, everyone.